Bad period pain is not normal. Yes, your period can make you kill yourself.
But you knew that.
Hi besties, it's Dr. Williams at your cervix today, and you're welcome to episode 2 of the Lola List. Today we'll be talking about 2 period disorders that affect millions of women globally. I personally feel like they are not being talked about enough, and that's why I decided to make this video. So the first topic we're going to be discussing today is dysmenorrhea, aka period pain. As women, I feel like we've just been conditioned to deal with all of the painful stuff that's accompanied with period. Personally, I do not like to see my period. It's such an uncomfortable period of my it's such an uncomfortable period of my life, honestly. Talk about the cramps, talk about the diarrhea, talk about the acne, the breast soreness. Like, it's honestly a lot, and there's no reason why you should be going through more pain than you need to be going through. I just want to start off by saying that bad period pain is not normal. It's not normal for you to be experiencing excruciating pain during your periods. It's okay to have light cramps, but it's not normal for you to be in severe crushing pain that medication is not even helping. That is not normal at all, and sometimes it could be a sign of something more serious going on. So let's break down dysmenorrhea. Dysmenorrhea is the medical name for period pain. And why does this happen? It's very simple. We all know what happens right before our periods, how your womb or your uterus prepares for that egg that it feels might just be fertilized. And if you don't get pregnant, what happens is that your uterus is going to shed all of this lining that is prepared for the egg, and that's what comes out as your period blood. Now, for your uterus to actually shed the lining, it has to contract. And contraction is basically it's squeezing against itself to push all of that blood out. Before we go too far, I actually want to break dysmenorrhea down into the classes. You can classify dysmenorrhea in 2 ways. So it's either primary dysmenorrhea or secondary dysmenorrhea. So let's get into that. So primary dysmenorrhea will typically start right when you start seeing your period, and we refer to this period as the menarche. It's the age where you first see your period. For some girls it's 10, 11, 12. It differs. But when we talk about primary dysmenorrhea, then it should occur around that time when you first start seeing your period. So when you're still a teen, when you're still very young. It typically starts around 6 to 12 months for some people, and typically what you would have is cramping some days before your period, and it could last into maybe the first, second, or even the third day of your period. Primary dysmenorrhea is typically caused by the release of some chemicals during your period which help your uterus contract, and that is thought to be the reason behind those crampy abdominal pains that you feel. These cramps are typically not so severe, at least they're not severe enough to affect your daily life. This pain could move to your back and it could move to your legs as well. And of course, there are other symptoms that come with periods such as nausea, vomiting, diarrhea, mood swings, and all of that. We typically treat primary dysmenorrhea by giving painkillers, okay? So something very safe would be a very simple painkiller like acetaminophen, which is paracetamol, or we could use NSAIDs, which are anti-inflammatory drugs like ibuprofen. So these typically should be able to help with period pain. Some other home remedies would be drinking warm fluids like tea, using a hot water bottle, resting, reducing stress, and so on and so forth. Now, when it comes to secondary dysmenorrhea, we're talking about period pain that starts years after you may have first started seeing your period. So at this point, you're no longer a young teen, you're probably not an adolescent, you're a full-grown adult. With period pain, it's also important to note that sometimes it gets better the older you become, and it might also get better after you have babies, but this is not the same for every woman. So with secondary dysmenorrhea, the pain is actually much more severe, and sometimes it can even be present outside of your period. It also may last longer than the pain that comes with primary dysmenorrhea, which just lasts for about 2 days, whereas this may last longer. It's also going to be pain that definitely disturbs your daily activity. So I'm talking it disturbs you from going to work or to school, and you're probably just in bed lying down in so much pain. I personally feel like women have normalized period pain so much that a lot of people end up bearing the pain during their periods, and they've never thought to themselves, is this even normal? I mentioned earlier, it's okay to have slight cramps. Yes, they'll go to your back, yes, they'll go to your legs, but it shouldn't be so severe that medication isn't taking care of it, and it shouldn't be so severe that even when you're not on your period, you're having these cramps. So let's go into some of the things that could cause secondary dysmenorrhea. One very big one is endometriosis, and this is a topic that we will go into in another video because a lot of women suffer from this, and it's one very difficult condition to diagnose. Another thing that could lead to secondary dysmenorrhea are fibroids. Yes, fibroids can actually make you have secondary dysmenorrhea, so this can actually increase the amount of pain that you're having on your period. Adenomyosis can also cause this, as well as PID, which is pelvic inflammatory disease, which we discussed briefly in my last video. So if you haven't seen that, you should definitely check it out. If as a lady you feel like you're going through very severe period pain, I really advise you to speak to your doctor because there might just be some help there for you. Do not think that this is normal. It's not some sort of pain that you have to bear and keep living with. Please speak to your doctors and find out if there are some investigations that can be done so a proper diagnosis can be made. Now, because we're already talking periods, I think it's a very good time to also speak about PMDD, and that's why I've decided to put these two topics together. I'm sure as lady, PMS is something that we're all familiar with, and these are just the symptoms that you have right before your period. They vary from person to person, but a lot of them are very common. And I'm talking symptoms like bloating, acne, mood swings, headaches, even diarrhea. There's so many other symptoms of PMS that I'm not going to cover here, but these are common symptoms that most women face right before their periods. Now, you typically experience the symptoms right before your period comes on, and when you start your period, they should start to ease off. Outside of PMS, there's another diagnosis referred to as PMDD, which is premenstrual dysphoric disorder. If you find yourself crying, extremely sad, and even depressed right before your period, this might be a sign that you need to speak to someone. Again, not all of these symptoms are always normal. It's okay to have mood swings, but when you find that it's on the extreme end and it's truly starting to affect your daily life, then it's time to speak up. PMDD is basically a very severe form of PMS. The symptoms are way more intense and it can greatly impact your daily life. I'm talking work, relationships, school. Now, the cause of PMDD is not clearly understood. However, it's thought that it could be as a result of hormonal changes. With each cycle, the levels of your hormones rise and fall, and in some people, the brain just seems to react weirdly to that. It's almost like your body is allergic to your hormones and your brain reacts super strongly to these changes. It could also be as a result of decreased serotonin levels, which is basically the feel-good hormone, and this can lead to more depressive symptoms. Some other causes of PMDD are alcohol, being overweight, and even some thyroid disorders, which we will get into in other episodes. Symptoms of PMDD will be very similar to PMS. However, they will be extremely exaggerated, and you might even have some suicidal ideation. Yes, your period can make you kill yourself. People who suffer from PMDD will be extra irritable, extra angry, and their mood will be all over the place. They could also have problems sleeping and even suffer from overeating. Again, this is why it's important to talk to your doctors because there's always help there for you. There are lots of medications that have been used to treat severe symptoms of PMDD, and there's always the option of speaking to someone like a therapist. So the next time you're feeling very worthless before your period, or you're feeling very down and depressed just because your period's about to come on, I want you to stop for a moment and think about this. It's unfortunate that we have to go through this as women, but that's why I feel like we need to speak up about things like this so more people can be better informed. Now that we've talked about dysmenorrhea and PMDD, I want us to make a Lola list of things that can help. The first thing on our list is to track your cycle and your symptoms. Now, this is very, very important. I find that a lot of women do not even track their cycle. They don't know when their last menstrual period was. They don't understand the phases in their cycle, and they don't know how that can deal with how they're feeling throughout the month. The luteal phase, for example, if you know, you know. I'm not going to talk about her. But it's very important to track your cycle and track those symptoms that you feel at every point. I think it will help for you to have a better understanding of what's going on. And when you're getting to certain phases, you already know the symptoms to expect. The second thing on our list today is to talk to your doctor. Talk to your doctor, guys. Your doctor should be the one person you shouldn't hide anything from. And I personally love when I see patients who love to ask questions. It doesn't matter how dumb or how silly you think the question is, you should always speak up and you should always ask about things that you're not clear on. You should always learn to advocate for yourself with your doctors. And if you're not satisfied with one person, always get a second opinion. The next thing on the list that might really help are lifestyle changes. Now, a lot of these issues can be solved just by eating a healthy diet and exercising. You'd be surprised. Exercise will make you feel so much better. It might seem like, oh, I'm going through pain, I'm depressed, why should I be exercising? But even simple exercises like yoga will really help to relax you and just make you feel better. Of course, like I mentioned, there are several treatment options. For dysmenorrhea, sometimes we even end up using birth control, and this helps as well. You can also be put on antidepressants if your PMDD is really severe. And of course, there's always the place for pain medication. I really want to encourage you guys to speak up. Speak to someone close to you. Speak to your doctors. Speak about what you're going through. There's always help out there, and I promise you, you're not crazy. As women, our hormones really can take control of our lives, and we really have to be very mindful of this. Anyways, that's all the time I have this week on the Lola list. I'd really like to hear from you guys down in the comments. Have you ever experienced any of the symptoms that I've spoken about today? Right before your periods, do you ever feel so low and dejected, like you're not yourself anymore? How are your period cramps when you're on your period? Are they severe? Are they mild? Do you not get cramps at all because you must be God's favorite? Let me know in the comments. Let's have a little chit chat down there, and I'll see you guys next week on the next episode of the Lola List. And until then, it's me, Dr. Williams, at your cervix. Bye.